So, the outline of the health services module at an LSHTM over one term looks at all these aspects, and it's helpful for us to organize health services into our inputs, our processes, and outcomes. And I think I will explain more about each of these aspects in a bit, but this is over 10 weeks. So throughout these next week we're together, I've got a condensed version for us. So we're going to look at certain aspects, also through inputs, processes, and outcomes. For a complete picture, I think it's important to consider these aspects of how the coordinate efforts of health services come together. And so today, I'm going to start off with some inputs in our next talk, with formal and lay care, a little bit about diseases and medical knowledge, a little bit about healthcare professionals. Hopefully we already covered some of those things. And then tomorrow we're going to look at a little bit of through a seminar, users of healthcare and the staff-patient interactions, a little bit of interactive time together. On Friday, we'll look at need, demand, and use through a talk. So looking at the activities of healthcare and how those relationships work, a bit more of a microscope dive into these activities that we consider to be direct activities of healthcare. And then on Monday and Tuesday, looking at quality of health services, what it means by quality in a little bit more detail, and also how do we measure outcomes, what are the challenges, and my own specific interest is looking at measuring effectiveness with patient-reported outcome measures and how we can use PROMs. And so I'll talk a little bit about that as well. So this is the plan for the week together. How are we doing for time? Okay, so before I move on to the inputs of health services with my second talk, should we have a little bit of a coffee, like a 5-10 minute break for coffee for something, and then we can reconvene after that. All right, thank you.